You know the feeling, a sudden twinge in your back tooth, and you start wondering, how long is the wait and what will it cost? As of 2026, 97% of adults seeking an NHS dentist in England are turned away. Over 2,000 dentists have left the NHS in 2 years. With current contracts making state-rate care difficult, practices returned nearly £1 billion in public funding since 2023. Even if you are already on a patient roster, the system is stretched thin. Routine appointment waits have stretched from a few weeks to several months in many areas. The historical NHS versus private debate is no longer about waiting room luxuries. It is a matter of basic clinical access. When you actually need work done, the price difference between the two systems is significant. An NHS porcelain crown is capped at £332.10, while private clinics charge between £500 and £1,200. But that higher price buys time. You might wait months for an NHS fitting, whereas a private practice usually sees you within days. If you feel a dull ache drinking your morning coffee, 4 months is a long wait to save a few £100s. Navigating this trade-off requires knowing exactly what you are entitled to within the NHS pricing structure. NHS Dentistry in England uses a 3-tier banding system. You pay one fixed charge per course of treatment, regardless of how many appointments it takes to finish the work. Band 1 costs £27.90p, covering examinations, x-rays, and basic cleaning. Band 2 is £76.60p, adding fillings, extractions, and root canals. Band 3 is £332.10p, including complex work like crowns and dentures. These are fixed course charges, so if you need multiple fillings and an extraction, you still only pay the single Band 2 fee. If you receive pension credit or universal credit, you may qualify for your NHS dental care entirely free of charge. This banding system is cost-effective for patients, but its rigid budget restricts material choices and limits practice availability. Private clinics set their own prices, which can vary significantly depending on your region. A routine private checkup generally costs between £50 and £120. That higher fee usually buys a longer appointment and a more thorough discussion of your options. Materials also change. While the NHS often uses silver amalgam for back teeth, private care defaults to tooth-colored composite. For crowns, you can choose stronger, lifelike ceramics like zirconia. Certain procedures are almost never available on the NHS, specifically dental implants for missing teeth. A single dental implant will cost anywhere from £1,800 to £5,500 per tooth. Private care is an expensive leap, but it purchases immediate access and premium materials that the public system cannot provide. Dental insurance can help manage these private costs if you are forced outside the NHS. Basic plans cost around £10 to £15 a month, covering routine checkups and hygiene. Comprehensive plans at £30 to £50 a month provide financial contributions toward major work like root canals and crowns. Most plans enforce waiting periods of several months before you are permitted to claim for major restorative work. Insurance also typically excludes pre-existing conditions, so a broken tooth you have today won't be covered by a new policy tomorrow. Insurance is a smart tool for long-term maintenance, but it is not a solution for a sudden dental emergency. Because private clinics set their own rules, you must ask the right questions before starting treatment. Ask if a quoted price includes the initial consultation fee and x-rays, or if those are charged separately. Find out exactly what materials will be used for crowns or dentures, and what guarantees the clinic offers on that work. You should also verify that the dentist is actively registered with the General Dental Council. Never begin major private treatment without a written, itemized cost breakdown. Reputable practices use transparency to build trust, ensuring you never face a surprise bill. Choosing between NHS and private care requires matching your clinical urgency to your budget. If you are already registered with a clinic, only need basic maintenance, and are not in active pain, you fall into the first scenario. Staying with the NHS will save you hundreds of pounds, provided you accept standard wait times and basic materials. If you are unregistered, in immediate discomfort, or require advanced restorative work, the second scenario is more likely. Transitioning to private care secures immediate relief, specialist attention, and more durable materials. For adults over 50, the decision hinges on the intersection of clinical complexity and geographical access. There is no universal right answer, only the clinically and financially correct answer for your specific situation. Waiting for an NHS crown is a valid strategy if you are comfortable managing the timeline. Choosing to spend more privately is just as valid if it resolves chronic pain and restores your quality of life. Use these pricing benchmarks and vetting questions to approach your next dental appointment with confidence. Proactive control of your dental strategy is the most effective way to protect both your wallet and your well-being.